The Autism Research Institute relies on the generosity of donors like you to make this webcast possible. If you enjoy this presentation, please consider making a donation. Thank you.
Now, before we get started, I'd like to introduce our speaker. Vicki Kobliner is a registered dietitian and nutritionist with years of experience in applying a functional approach to nutrition. She develops individualized plans for clients, which are designed to promote wellness, prevent disease, and rebalance underlying nutritional impairments. A key element of this approach is the optimization of digestive function. Research shows that impairments in this critical nutritional pathway can have a far-reaching impact on the brain, immune, detoxification, and other seemingly unrelated systems. Vicki has extensive experience in using dietary modification, appropriate supplementation, and functional lab testing to achieve wellness. You can type your questions into the question section starting now and throughout the talk. We'll answer as many as we can in the hour to come. These webinars are made possible through generous donor support, including a grant from the Local 25 Boston Teamsters. If you'd like to contribute, please visit our website at autism.com. And so now, Vicki, we'll get started with some questions.
Great. Thanks,
All right. Okay, well, we're glad you're here. Okay, so the very first question, I know we get this one a lot, but it's a good one to start with. This person's asking, does the whole family have to go on a special diet to prevent contamination in the kitchen?
Great question, and one that, yes, we do get a lot, but I always think it's great to have that out on the table really early. It's really a personal choice. But that being said, I think every family needs to understand what works for them, and arbitrary rules, listening to other people telling you you've got to do it this way or you've got to do it that way, is not going to be productive. It's got to be what works for your family. But at the same time, I do find that when you're trying to balance the needs of a variety of people, it's harder to keep it so clean. You know, especially if you've got little ones in the house and one of them's getting something that, for example, may contain gluten and the other one doesn't, how are you going to avoid those crumbs falling on the floor? How are you going to avoid the little one picking something, one little one who's gluten-free picking something up from the other one or grabbing something out of their hand? I think there's the potential for a lot more infractions when the home is not clean. I tend to say, and this works for a lot of families, that you could tell the family, number one, in the house we all follow the same diet. It's all free of whatever the potential triggers are. Outside the house, if you have a child who is in school or if you have a spouse who's working outside the home and he or she wants to buy lunch, then that would be fair enough to allow those foods. But inside the house, I think it just makes it easier, especially for one who's managing the house, to have everything clean. The other piece of that, though, that one might want to remember is very often we see genetic similarities in families, and even though we're therapeutically prescribing this diet to one family member, very often all the family members find they feel much better if they incorporate it, and they don't even realize how much better they feel or how they were being triggered themselves until they try it. So I usually recommend everybody tries it. And then if they really don't feel any difference, then outside the home, each person can make their own choices.
Okay. And related to that, this person's asking, my son doesn't have any allergies to gluten, dairy, or soy. We tested him. Why would he need to go on a special diet if he's not allergic?
The responses to gluten, dairy, soy, and other foods are not necessarily frank allergies. Allergies are a specific type of response, and they are, when we think about something like peanuts or we think about certain trees or pollen, it's our body producing an antibody to that, what's called an antigen. And if the body produces the antibody, we see that in the blood. However, there are other reasons why gluten or casein or soy might be a problem that don't have anything to do with those types of antibodies. First thing is IgEs are the frank allergies that your allergist will generally test for. There are another type of antibody called IgG, which often the allergist will say don't mean anything, but in our experience in the integrative community, we actually see a lot of people respond to IgG. When they have a high IgG to something and we remove it, they actually do better. So that's the first reason. It may be that the allergist is saying there's no response, but there is an IgG response. Secondly, even without an IgG response, sometimes people just don't produce that kind of a response at all. They may have, there's complement factors, which are another way the body reacts. There may be a problem with the opiate mimicry of gluten and casein. So gluten and casein have proteins that actually look very similar to morphine in their molecular structure. So for some people, if those molecules actually can access the brain, and there's a variety of ways that they may do that, we may have kind of a drugged effect, almost as if they were on opiates. So that could be the problem. It could also be non-gluten celiac sensitivity, which we are seeing much more commonly, but which causes not only digestive complaints, but also things like brain fog. And we see that with people who don't clinically show the specific type of reaction that we would expect. So for me, and the other thing is, while food sensitivity tests can be helpful, they are notoriously inaccurate. So I usually describe them as a bad map in the forest. So if I was lost in the forest, I would really want to have some map, but the map I have is going to make me make a lot of wrong turns. So food sensitivity tests can be helpful, but they're not an absolute. And the only true way in my experience and the experience of many of the colleagues I work with, that we see productivity is trying a diet and seeing what happens therapeutically. And if it doesn't work, you can always stop. The one thing I tend to want to avoid is having somebody look back and say, oh, I should have done this 2 or 3 years ago. The earlier you do it, the easier it is. And if it doesn't work, you can always challenge the foods and be confident that you tried that and you ruled it out, as opposed to wishing down the road that you had tried it.
Okay. This question is, if my child absolutely refuses to eat what we need him to eat, what do we do? Do we let him go hungry? How can we help?
Kids are all different. I think that most kids, if they are left to their own devices, ultimately will choose healthy foods. But when our kids have been conditioned, either because they've been self-limited and we've wanted them to eat for obvious reasons, and so we've given them what they requested, they've become conditioned to only want those foods. Most kids will not let themselves starve, even if they go a few days without eating. But I have seen kids on the spectrum who really literally refuse to eat for long enough time that it actually even made me nervous. But what I generally start with is part of it depends on your child and what you think your child is going to react and respond to best. There are some people for whom cold turkey is the way to go, and they are willing to have their child not eat too much for a couple of days, as long as they're well hydrated. And, we can go weeks without food, technically, but not without hydration. But we really don't want that for our kids. That's not what we're recommending. But if, some parents do choose cold turkey and say, I'd rather get it over with in a short period of time and just break them of this habit. We've had kids that have done that and done really well that way. Other parents will try slowly to say, okay, well, if we're trying to get gluten out, then let's try to use some gluten-free pastas instead of the regular pastas. Let's figure out where the sources of gluten are and how we can replace those slowly but surely. So it may take months to move a child from the problematic foods, the gluten, the dairy, the soy, whatever else it may be, by replacing them with other things. For others, we can use, I try to figure out what it is that they will eat. Some kids prefer liquid. So if they're going to drink a special shake that we make for 3 or 4 days and that's all they're getting, we can do that too. If they only like cold foods, let them have cold foods. If they prefer warm foods, let's focus on warm foods. If the textures are only crispy foods, let's figure out which foods are crispy. So we try to figure out from child to child individually what are the foods that they will eat that are still acceptable, and what are the foods that are most problematic that we want to get out, and we prioritize that, and then we try to slowly shift. It doesn't have to be cold turkey, but yeah, ultimately, you do want to get your child to stop eating those foods that can be triggering for them. In terms of things like vegetables, which many of us have challenges getting our kids to eat in general, again, would they eat a vegetable soup? Would they eat it when it's a vegetable chip? Would they prefer it if it was pureed or if it was crunchy or if it was raw or cooked or cold or hot? Can we mix it into other foods? We try to find ways to get those foods in that can be varied so that depending on the child's particular needs, we can find a vehicle that they'll use. And Usually we can find one or two, and then we try to expand it. You know, things like zoodles, zucchini noodles, carrot noodles. Some kids will eat them in noodle form when they're cooked with some pasta sauce on them or something like that, where they won't eat a raw carrot or cooked carrot coin, for example. So we try to find creative ways to do that. But it's a combination of slowly weaning out the undesirable foods and slowly bringing in the new foods. And very often when the undesirable foods are removed, kids will start eating a lot more foods we never thought they would.
Okay. You touched a little bit on allergy testing. I wondered if you could describe the different types of testing. I know there are different types of allergy testing. There's IgG and IgE. There are quite a few questions about that. And when you're describing, being out in the forest with a bad map, does that apply to all
Right.
testing, or is it specific to
It pretty
panels?
much applies to all testing, and you are going to see that there's a ton of different ways people test. If you go to an allergist, very often they'll do skin prick testing, which again for food is not particularly accurate. Then you'll do the typical blood test looking for IgG, IgE, those types of reactions. Then there are things like what they call ELISA testing. There are companies that do what's called mediator release testing, and there are all different ways to look at it. Mediator release testing actually looks at so, for example, your IgG or IgE testing is going to look at the production of those antibodies to an antigen. Mediator release testing actually looks at how much fluid is inside and outside a cell based on its exposure to a specific antigen. So what they look at is inside the cell there's fluid, and there's also these different types of antigens or reactants. And when the reactants are exposed to some sort of antigen in the blood, they'll leave the cell and go out into what we call the extracellular fluid. So by looking at how much volume remains in the cell and how much leaves the cell and goes out into the other fluid, when it's exposed to some sort of antigen, some sort of challenge, that can tell us, wow, these blood cells really reacted very strongly to this gluten, and a lot of the contents of the cell went out to fight the gluten, for example. So that's one way to look at it. So there are different ways people test for food sensitivities, but again, none of them are perfect. All of them have both false negatives and false positives. And so we use them again as a guide, but not as an absolute. And in terms of what is the better type of testing, unfortunately, depending on who you talk to, you're going to get a different answer from whoever uses the test that they feel most comfortable with and the ones that their research has made them believe is more accurate. And there is no one standard answer. And I know that's really frustrating for parents. And it's frustrating for us as clinicians because we really wish we had better data and better ability, better testing that we could really define this. So we use them as guides, but we don't use them as absolutes.
Okay. That's really helpful to get that breakdown on that. Here's a shift. This person is saying, we've had our child on a very clean diet for 10 months, everything strict, gluten-free, casein-free, soy-free, high nutrition diet, but they haven't seen significant changes in terms of activity level. So their child's really active, and they were anticipating there would be, activity level would drop, and they haven't seen that yet. So do you have insight about your experiences with that, observed changes in behavior versus not changing?
Sure. So I'm sorry that you've worked so hard. It sounds like you're doing a great job, but you haven't seen the results that you wanted, because I know it is a ton of work. Couple of things. Could be that even though you believe in your best efforts, the diet is really, really clean, there's some sort of hidden something that you're missing. So you may want to just go through your pantry and review all the food that he's actually or she is actually eating. For example, I know one of my colleagues that I work with always talks about the fact that we had a child who we thought was really perfect on a gluten and dairy-free diet until we realized that they were chewing gum, and the gum itself was the only thing that was actually contaminated, and it took us a long time to realize that. So it can be down to that small level. In addition to which, even if it's gluten, dairy-free, etc., there are people who are sensitive to nightshades or phenols or histamines or glutamates, and so it may be that that bone broth that we think is so terrific for gut healing is actually problematic for this specific child because it's high in glutamate, and that can be a trigger, especially for hyperactivity. So sometimes the food we think is most helpful is something that in actuality this particular person is reactive to, and sometimes it's important to tease that out. I tend in those cases, I think it's really important to work with a nutrition expert, dietitian, or a qualified nutritionist. But I also tend to sometimes do not the typical rotation diet we think about with allergies, but something a little bit different where we actually will eat a confined group of foods for a certain amount of time, and then we'll switch to another targeted group of foods, and then we'll switch to another targeted group of foods and see if we see changes in behavior. If so, if somebody gets worse when they're only eating the food of week B, for example, then we start drilling down more into week B to see if, wow, what are the foods in that we, assigned to that week, that round that may be problematic, whereas they actually did better in week A or week C or whatever it might be. And we design these based on individually, based on what the child's presenting with. But sometimes I find that really helpful because it may be just a specific food that's not part of a specific category, but it's problematic for that child. And so sometimes you have to drill down deeper. The other thing, though, that I would also recommend and be really careful about is when you do restricted diets, we also don't want to over-restrict because then we might think we're doing a great job, but maybe the child's missing a nutrient that he really needs. And if that's the case, then we also need to make sure we're replenishing properly, whether it's with supplementation or adding back in a food that's rich in a certain nutrient. I also think you have to look at your supplement protocol and it may not be the food. It may be something else. It may be a disruption in neurotransmitter function. It may be a therapeutic need for magnesium that's not being met. It may be more yeast overgrowth that's causing hyperactivity. So there's lots of reasons that may not be directly food related. And sometimes we spend a lot of time thinking about the food. Maybe the child needs some herbs, some adaptogenic herbs that are going to help the body get back into balance. So all of those pieces come into play. But I commend you on the fact that you're trying a really clean, nourishing diet, and that can only be doing well for your child.
Okay, this question's about adulthood. So this person has a 21-year-old daughter who has behavioral issues, and they're doing biomedical treatments, but they haven't done any nutritional, they haven't done a diet. And this parent's asking if 21 is, at that age, is it appropriate to try a gluten-free diet?
Not too late. Not too late. I have clients who come to me who are not on the spectrum per se, but who are adults who say, I've never felt quite right my whole life, and they can feel terrific after they start these diets. We always say, and I still, believe that the earlier the better, but I've had clients who were in their 20s who made dietary changes and saw good improvements, whether it's just quality of life improvements, whether it's more calmness, whether it's less self-injurious behavior, whether they just seem happier or their bellies feel better. It's never too late. So I'd say go for it.
Okay. And another parent is asking, oh, sorry, we're getting so many questions, it just jumped. They're asking about doing that diet in adulthood if enzymes can actually replace the need to do the diet. So with an adult, they're saying it's challenging to change the diet at this point. So would taking digestive enzymes at least be worth a try?
Absolutely. I don't think digestive enzymes are ever a replacement for the diet, and I would never say that, whether it's a child or an adult. But I do think enzymes are advantageous, and there are a number of studies that show that kids who, and this is, again, studies that were done in kids on the spectrum, but they were kids, but that when they were given digestive enzymes, they actually did improve both functionally and digestively. So I don't think there's any downside to trying the enzymes. They are not a replacement for the diet, but they can certainly be an adjunct to what you're currently doing.
And they want to know, what do enzymes do? What are they for? And where can I buy them? Or where should I buy them?
Okay, great. So enzymes are compounds that help. The enzymes do a ton of things. And there are all different types of enzymes. Really what we're talking about here are digestive enzymes. That type of enzyme basically is produced in response to food. For example, when we eat, the first thing we produce is something called salivary amylase. And amylase kind of helps break down sugars, carbs. And then we have lipases, which break down fat, and proteases that break down proteins. And what we need, all of our food when we eat it, think of it as kind of a long beaded necklace. And what we really need to do is break that necklace into all the individual beads before our bodies can digest it. But we need something to help us break those bonds that are holding those beads together. We need to snip in between each one of those beads. Enzymes are the scissors or the snippers that go in between each bead and break it up. So one of the things we see with people, and when people have digestive dysfunction, is that sometimes they're not producing enzymes appropriately. Sometimes their body, and there are all kinds of different ways our body triggers enzyme production. And if that's not happening, then we're not snipping those beads. And so maybe we have a 3, 4, 5 bead chain in our gut. And our body doesn't know how to digest that. It doesn't know what it is. It looks at it as something weird and foreign, and it doesn't accept it. And so that's where a lot of the disruption starts. When you snip those connections between the beads and you get those single beads, those can pass through the intestinal wall. They can get into the bloodstream and go be carried wherever they need to be carried to do their good work, all those nutrients. When the beads are, the bead chain is too long, we can't get access to those nutrients, and they actually are perceived as foreign. And those are some of the things that cause inflammation and allergies, or what we call sensitivities. So the enzymes help snip all those beads apart.
Okay. And related to that, they're asking about, this is a different person asking, but they're asking about probiotics. So are there certain strains of probiotics that have been found helpful for people on the spectrum, and how would I identify them, and where should I purchase them? So they asked that about enzymes as well.
Right. So 2 questions. The one I didn't answer, which you reminded me of, is where to purchase them. And purchasing supplements is the Wild West. It is really dangerous out there and crazy. Anybody can sell supplements. They are not regulated by the government in any way. And so we have people who produce incredibly high quality, ethical, efficacious supplements that can really do wonders for our health. We also have people producing garbage that may be contaminated with mercury and lead and arsenic, that may not have anything in it that it says it has. It may say it's calcium, but actually have nothing in it but chalk or some sort of powder. We may be buying probiotics that are dead. So knowing where to buy them is really important. And the one place I would say is no big box, no third party, none of those big online e-commerce stores. Because if you can't trace the product from the person you bought it from, then you shouldn't be buying it. For example, if I sell something to a customer and they call me up, and I've had this happen, it looked funny. I'm used to it looking white, and today it looks speckled. When I opened the bottle, what does that mean? They tell me the lot number. I call my supplier. They go back and they look exactly at that lot number. They go back into their warehouse where they've kept a batch of every lot that they've ever produced. They retest it. They make sure it's okay and that it's safe. And we can follow that chain from start to finish. When you buy something from one of the big online retailers, they're often sold through a third party. And you don't know who that person is. You don't know how to get in touch with them. And very often, and this has been proven, there are a number of studies that have been done that show that much of the stuff that sites is either counterfeit, so it's been labeled, or it's expired and relabeled. I have vendors, people who produce supplements who tell me they've bought probiotics that were dead with their name on them. They've bought things that had their name on them that came in a bottle that they've never ever owned, used. It's not one of their bottles, and yet it had their label on it. So I don't trust anything that comes from those stores. I think you need to find a reputable practitioner that you work with. And sometimes it's a health food store, but again, I don't even trust what they sell in health food stores. But you have to find somebody who sells reputable product, who has a face, and you can relate to them, and you can go back to them whenever there's an issue. And good quality supplement companies, and I don't know if we're allowed to name them or not name them here on the web, on this Q&A, but people can email me offline if they want, and we can talk about some of those things. So that's what I would do. I think you have to find a reputable seller who understands supplements and understands exactly what companies are safe, efficacious, and high quality, and do proper testing so that you know that what you're buying is viable. And that's why sometimes they're more expensive, and that's why even though it seems like you might get it cheaper somewhere online, it's not always the best choice. In terms of probiotics, there are many strains that have been shown to be efficacious, and I don't want to get into all the details of all the different strains here. It's a little overwhelming. But we know that there are some that are more specifically helpful for constipation, others more specifically helpful for diarrhea. There are others that there's a new one that just came out, a probiotic blend that actually is being used for mood, for depression, and there's some good research behind it. So I don't tend to stick with one strain because our bodies don't have one sole strain in them. They have a multitude of strains. So I tend to use a multi-strain probiotic. It has to be very high quality. And again, that comes to knowing your resources and knowing your vendors and who that is. But has to be high quality, has to be multi-strain. Generally, there are certain things we look for. For example, if a child's suffering from something like Pandas or Pans, I'll tend to avoid anything that contains a strep strain, because even though technically there's some research behind those that says that they shouldn't be a problem, anecdotally, a number of my clients have had problems with it. So I don't use strep strains with people who have strep sensitivities. When people are using things that, and this is a whole nother thing to get into, but if they're using anything like helminthic therapy, I tend not to use lactobacillus strains. So it becomes more complex than just this is a good strain to use. It again depends on your individual child and what they need and what else is going on in their care plan.
Okay. If they have a bad reaction when you start something like probiotics, would you suspect that it might have to do with the issues of strep, or would you be looking at those sorts of problems?
So could be a variety of things. And again, working with a reputable practitioner is a really good thing. So first thing you think of is it might be a Herx reaction. If everybody's not familiar with a Herx reaction, what that means is that when you put probiotics in, you may be crowding out some of the other bad germs, yeast, etc., or you may have added some sort of antimicrobial to kill some of the bad germs. If you're thinking about yeast, leaky gut, etc., when those die, they're kind of like balloons, and when they get popped, they release their contents into the digestive tract, and those contents can really make you feel yucky. They can give you diarrhea, they can give you constipation, they can make you have sleep changes or belly pain. So it could be the fact that whatever you just started is really working, and that's a great thing, but you don't want your child in pain. So you may need to back off the dose a little bit, see if that helps. Sometimes activated charcoal can be really helpful because that actually absorbs all that yucky stuff in the gut and helps to excrete it. However, activated charcoal absorbs everything. So you don't want to use it if you've just given medicine or supplements. You need to wait a few hours because otherwise it'll absorb those too, and you will have wasted your money, your time, and your child won't get access to the nutrients or the medications that they need. But again, yeah, it could be if there's a strep strain in it, could be a strep problem, could be that they don't tolerate a specific strain particularly well. Some people, again, in talking about the types of probiotics, there are what we call spore-forming organisms, and there are others that are not spore-forming. Do better with one versus the other in that regard as well. So sometimes it requires playing around with probiotics to see which one is best. But if you get a bad reaction when you first start, my first recommendation would be don't get scared, don't assume it's a bad thing. It may actually be that it's working. So try some activated charcoal, possibly back down the dose a little bit, give it a few days to wear off, and see how that goes. And if it's still a problem, then we need to probably switch to a different type of probiotic.
Okay.
And again, these are not specific recommendations. These are general, and this is not medical advice.
Okay, this person is asking about camel milk for dairy-free kids for gut health and easing symptoms. I think they mean behavioral symptoms. So do you know anything about camel milk, or its
Sure.
relation to this?
Yeah, so again, camel milk, I've heard terrific things about it. I've used it in my practice. I've seen some good responses. Not with everybody. There is no panacea. That's the one thing I will tell everybody who's listening about everything that we do is there's not one thing I've ever tried and nothing my colleagues have ever tried that works for everybody. So that's part of the challenge of going online and reading and hearing and watching and listening is that we feel like, well, if everything's going to work for everybody, and that's just not the case. So the thing that could have been wonderful for your friend or your neighbor may not work for you or your child. But camel milk, yes, much less reactivity than cow's milk, seems to actually be anti-inflammatory in nature. So it can have a lot of benefits. I don't generally recommend people, like if you're trying a gluten and dairy-free diet, I think you really need to be gluten and dairy-free. But then down the road, when you've determined either that it's helpful, but you think your child is ready to try some, is doing really well, you want to challenge with a few foods, that's a good time to try it. If you haven't seen any change with the diet, you might want to add it back in. Camel milk appears to be more anti-inflammatory, so actually may be helpful. But again, I wouldn't use it to start. I wouldn't use it as an excuse not to go dairy free. And with cerebral folate issues, kids who have cerebral folate issues theoretically should not really be using camel milk, but I also know people who've said that even with that, their child has done well with it. So again, a little bit of a hedging my bets here. I think it's worth a try, but it's worth a try within the confines of a plan that includes a gluten-free diet, a dairy-free diet to start, and not going straight to like gluten-free camel's milk.
And on this milk theme, so what about goat milk? Is that a substitute? Can you drink that if you're dairy-free?
No. I think if you're dairy-free, and I think everybody who's trying this should start to be completely dairy-free. And then in the continuum, and as long as we're talking about this, we may as well talk about A2 milk as well, because A2 milk is cow's milk, but it's a cow's milk that's been shown to be less inflammatory and better tolerated. So there are people, and now it's available in the U.S., so there are people who are now buying A2 milk, which again, a lot of kids with asthma seem to do better with A2 milk than regular milk, A1. But I don't think anybody who wants to trial a dairy-free diet should use any of these as a replacement. I think you do the dairy-free diet first, and then down the road, you start by trialing some of these milks. And goat milk is much more like human milk than cow's milk is. So yes, it's better tolerated. I also think we should start with a plain yogurt because it's fermented and it's got that good bacteria in it. So I generally start with a goat yogurt or something like that and do that before I do the milk, because again, the fermentation is going to break down a lot of the sugars that can be problematic. It's also going to break down a lot of the compounds in the milk that are problematic and make it easier to digest, and also provide some of that good bacteria that we know is helpful. So it is a continuum. It's gluten-free, dairy-free. Then if we need to challenge, let's challenge with a yogurt or a fermented milk product, ideally not from cow's milk, from a different type of milk, whether it be goat or camel, and then build up from there. And that's kind of the way I look at it.
Okay. And I know we've done webinars before on different diets, so this shouldn't, you don't need to feel like you're being put on the spot, because we can always point to those. But this person's asking if they're trying to implement dietary intervention at home. They've read about all these different diets and they want to know, like, where do you start? It's like, is it gluten-free, casein-free to start? Do you just take away one thing at a time? What's the primer on getting started?
So when I do lectures on these different diets, and I all call them, the alphabet soup of diets, the FODMAPs and the SCD and the GAPs and the GFCF and the whole bit, it is hard to figure it out. And again, the right diet may be different for different people based on what their child's presenting with. If you have a child who has seizures, we really would want to be looking at a diet that's very low in carbs. If your child, and again, for every child, processed carbs, in general, we want to eliminate or minimize. And again, that's one of the problems with gluten and dairy-free diets is very often families will get so focused on, well, I need a gluten-free cereal, and I need a gluten-free pasta, and I need a gluten-free cookie. And so what we're doing is we're taking out the gluten, which is great, but we're not taking out a lot of the processed foods and all the sugar, which can be equally problematic. And that, by the way, the other question about the family that was doing the diet, they did say it was a very nourishing diet, so I was assuming they don't have a lot of processed food in there. But that can also be a reason why some people don't react well or don't react the way people hope to, the removal of gluten and dairy if the diet is still very processed. So I think as a baseline, gluten and dairy-free and soy-free, because dairy and soy are really cross-reactive. But I think as a baseline for anybody, gluten, dairy, soy-free is a great place to start. And if you really don't know what else to do, I would start there. But if you have or your child has other markers that indicate a different diet, it's important to have somebody you're working with who can help you with that. So if there's, low oxalate diets are often indicated for kids who, families with histories of kidney stones and kids who do eye poking, and they may do a lot of genital stimulation, because then we think that may be just like a masturbatory behavior, but actually it might be that they are having pain, because pain in the genitals can come from oxalates. So if a family tells me, this is some of the stuff that's happening with my kid, I may not say, let's just do gluten casein free. I may say, we really need to also look at minimizing oxalates. Again, if there's seizure activity, we may go straight to something like specific carbohydrate diet because we're going to remove a lot of those carbs that are linked to more seizure activity. So as a baseline foundation, I think gluten, dairy-free, soy-free is great for anybody to start with. But for each individual, there may be another diet that's more appropriate for them based on their history and their other symptoms.
Okay. Is this diet forever? So this question always comes up too. So this person has started a diet and they want to know, is this the rest of my life? Is it just for 2 years? What are we looking at?
I don't know. I'm sorry. I really don't know. For some people, it's forever. I have had clients who have been able to come off it, either modify it, do a little bit of gluten and dairy here and there, do it with enzymes, etc. If the gut was healed well, then some of them are able to come off it. There are others who, when we've challenged it, they regress and they really are probably not going to get off it anytime soon. So there is no absolute. With something like specific carbohydrate diet or other diets that are really designed to do a lot of intensive gut healing, there is a lot more opportunity to expand those diets for sure. So people who start on a specific carbohydrate diet or a GAPS diet generally ultimately do add a lot more foods. Even something like FODMAPs is very stringent in the elimination phase, and then it begins to broaden as you go forward. Those diets, I do tend to see people being able to add a lot more foods to it. With gluten and dairy free, the gluten and the dairy tend to be the ones that are hardest to add back in, and you just don't know. So it's a trial and error type of experience.
So I'm imagining over the years you've had experiences where you've seen kids get better, but there's still behavioral issues around food. So maybe food refusal, unless there's some sort of, I don't want to say bribe, but that's really what it is. If you eat
Right.
your carrots, you get a candy bar, that kind of thing. So
Right.
have you seen strategies families have used to address the behavioral symptoms along with the nutritional?
Oh, for sure, for sure. And again, team approach with everything. Part of it is if there's that addictive behavior, and again, we talked a little bit about the opiate type thing. You'll see a lot of addictive behavior. The kids who want to drink like a whole gallon of milk at the exclusion of everything else. Those kids, they need to be detoxed just like anybody else. They just need to stop because they're not going to choose anything else if they're getting their drug of choice. But when they stop, very often what we see is those other foods they used to not eat, that they will start eating and their diet will expand on its own, which is really nice to see and really terrific. For others, they continue to be limited. And generally, we look for things like, is there a zinc deficiency? Sometimes a zinc deficiency, or is there pica that's generally pointing to other nutrient deficiencies, mostly minerals. So if we see mineral deficiencies, sometimes addressing those will improve taste perception and somebody's desire to eat a wide variety of foods. The other thing is small and incremental exposure. It's really exposure therapy like they do for people who have all sorts of phobias or fears or limitations, which is, I think as parents, we tend to do something like, and I've talked about this a lot before, if you look at old webinars I've done, I'm saying the same thing. You start with the broccoli and you give them, a big scoop of broccoli on their plate and you tell them to eat it and they're freaked out and they don't want to eat it. And so then you take it away and you don't give it again for another month. And then you give them the big scoop of broccoli and then they don't want it and it's a whole big fight. Well, I wouldn't want to eat something that that I thought looked or might taste or might feel really uncomfortable in my mouth. If somebody said to me, here, have just this much of it, have one bite, that's all you need to take, then that's a lot more accessible and a lot more doable. So maybe you get them to take one bite, but then you have them take one bite at every meal for a week. A pea, one carrot coin, one leaf of spinach. And then once they become acclimated to that and they realize that, wow, it's really not that scary to eat this food, it's not so terrible, then you can start giving it to them more regularly. But it's the constant exposure in smaller doses as opposed to large exposure infrequently that I think is more productive. I also think, again, if we can't get a child to eat spinach if it's raw, let's try it cooked. Let's try it mixed inside the meatballs. Let's try different ways, because once kids are exposed to those tastes, ultimately they will start to adapt to them. It's the getting them to get exposed to it that's the problem, and that's why we want to do little bits, possibly hide it, and also figure out the form. If you won't eat a beet, I don't care if it's a beet chip. It's still a beet. And, we're not really fat averse in this community. So I don't have any problem with a carrot chip, a beet chip, sweet potato chip, if that's the only way they're going to get it in.
Okay. This is a good question. I have a teenager, so I can relate to this one. They're asking about satiety. So a child who is always hungry, no matter what. They're getting plenty to eat, but it's just never enough.
Well, part of that may be dysbiosis. So very often, we know our yeasty kids tend to crave a lot of carbs. That may be part of it. I would want to know what this child's weight is. If he's overweight and he's constantly hungry, then it's probably more about the types of foods he's eating. And then I would really be looking at, have lots of veggies around. So when he's hungry, that's what you're going to offer him. And the other stuff is just not an option. If it's a child who's slim and constantly hungry, then I really want to look at their metabolism. Are they malabsorbing? Are they having constant diarrhea and excreting what they're ingesting so they're not actually getting access to those nutrients? Are they on a very low carb diet, which is causing them to be in ketosis when you tend to lose more weight? Some kids, when we start SCD, they will be so ravenous. They want to eat constantly, and parents will get nervous and say it seems abnormal. But really, the answer is just feed them. As long as it's healthy food that they're eating and they're not overweight, then feed them. But if it's really a more concern about obesity and they're not in touch with their satiety cues, then you want to fill them with lots of fiber and lots of volume, which comes generally from things like vegetables or legumes or things like that. So those would be your go-tos to try to offer them between meals to get them full, but also not get them to eat excessively. And again, dealing with whatever dysbiosis might be there, which is causing them to have these cravings, because that's a big piece of it.
All right, this is a big shift, but it'll be fun to talk about. They're asking about flours. So not flours that we grow outside, but flours that we use to bake when we're going gluten-free. And they've already acknowledged that rice and maize or corn are both problematic. So what are your favorite flours? Yeah, what are your favorite ones?
Oh, again, I tend to keep them all limited. I try to look for alternative ways. We just don't, personally and professionally, I just don't use a lot of that stuff. I try to get away from the whole I need a pancake or a waffle or cereal for breakfast. And we focus more on things like, eggs or meats or nuts or seeds and things like that. But when you need a flour, depending on what you want it for, you might need different flour combos. But millet flour works, amaranth flour works, sorghum, buckwheat flour. Those are the grains that you might use. Nut flours, almond flour is great for lots of things. Bean flours can also be added. Now, again, some people believe you can eat beans. Others feel that, it's not, like certain paleo diets don't include beans. So beans can be harder to digest, but I also think they do have a place and they can be nourishing. So any of those can be great. The question is, it's not always a one or the other, because in order to get something to rise or to have the right elasticity in your baked product, sometimes you need a combination of different flours. And there's a ton of different flour mixes and flour mix recipes online that are fairly easy to find. But I agree, rice, corn, those are not my favorites. I tend to use more of the whole grain flours and nut flours, because I really do like those as well. And they're great. Nut flours are actually great for breading, because we're really not asking it to do much. We just want that crispy coating.
Okay, you mentioned yeast overgrowth earlier, and somebody jumped on that. They had a question about that. So what are the signs of that, and what are the symptoms that you might see in a patient?
So in our guts, maybe I was assuming everybody might know what it is, but I should really explain it better. So in our digestive tract, we should have what I always describe as a lawn. It should be a lush, rich carpet of bacteria, good bacteria, that I say is like grass. We want to have, our lawns, we want it to have a lush, rich, thick carpet of grass. But we all know that with our lawns, very often we get these brown patches and patches where the grass has died, and then weeds start to come in. Same thing happens in our guts. The weeds will start to grow, and those weeds are often something called yeast. And as the weeds grow, the probiotics are important. They help us digest, they help our immune function, they help our detoxification pathways. They actually help our mood. We talked about the probiotics before and the fact that certain ones of those can actually improve mood. So probiotics are important for everything. They protect against disease. They're just extraordinarily important for us. So when we've got those brown patches all over our intestinal lawn, we have these weeds growing in. They cause havoc. And what that havoc can lead to is digestive problems. Those are some of the most common. But then we also see as they cause something we call leaky gut, which means that the permeability, the intestinal wall is supposed to be very tight and very protective. It's not supposed to let anything through unless it's kind of approved, like those little beads we talked about before. When you have these undesirable pathogens in the gut, it causes the intestinal wall to be a little more porous. And so maybe a 2 or a 3 bead chain will pass through, and the body doesn't understand, the bloodstream, the body does not understand what that 3 bead chain is, and it starts to react negatively against it. You can get brain fog, you can get physical symptoms like rashes, you can get mood changes, you can get joint pain, inflammation, as well as the digestive discomfort. So that's what we call leaky gut or yeast overgrowth, is when you've got an imbalance of your good grass and your undesirable weeds. And again, grass is probiotics, the weeds are the yeast or the bad bacteria and the things that we really don't want growing in our gut. And they like carbs. They thrive on carbs, especially processed ones. So as we eat those very high carb diets, we're feeding the bad guys, we're feeding the weeds. And we don't really want to do that. And the good guys, the lawn, the probiotics, the grass, they like vegetables. So another good reason to up the, natural vegetable, fruit, good fiber, good natural plant products, and reduce the processed carbs.
All right. And along with yeast, you also have touched a little bit, just a tiny bit, on Pans and Pandas. And I had a couple of people ask, what is that? What's Pans and Pandas? So can you give a high level on that?
Absolutely. High level. Pediatric autoimmune, Pandas is pediatric autoimmune neuropsychiatric disorder associated with strep. Pans is similar, except it's not necessarily associated with strep. It's associated with another virus, bacteria, etc. And what that is essentially is we're finding a host of kids more and more who, and this is one of the hallmarks of this disorder, and what is required for you to be diagnosed with something like this is an acute onset. So somebody who might have been fairly fine, and then literally overnight, all of a sudden is acting extraordinarily anxious, has huge separation anxiety, has OCD, inability to eat, becomes anorexic. Huge changes in handwriting are actually one of the things we see, and you can show a child's handwriting before and after treatment, and before onset, after onset, and then after treatment, and it's amazing how different it looks. They become dysgraphic. So those are some of the things that you see with these acute onset diseases. And they basically, what happens is these germs, for example, with strep, these germs get into the body launches an attack against the germ, but because of something called molecular mimicry, the antibodies to the strep start to attack the brain. So then we see these acute changes in behavior. And so you really need to address those by getting rid of the infection and tamping down that antibody response so that it's not aggressively attacking the brain as well. So these are, as they say, acute neuropsychiatric autoimmune disorders associated with various microbes. And they're often missed. Kids are often prescribed antipsychotics or other psych medications because it's perceived as, oh, they have separation anxiety, they have OCD, it's a psychiatric disorder, but actually it's not. It's an infectious disorder. And there's some really good literature about it. Swedo is one of the researchers who's done some of the seminal research on it. You can Google Swedo, Swedo. And there's a lot of information. There's a network in Connecticut where I'm from called the New England Pans Pandas Network. There's a phenomenal resource. If you think your child may have had this kind of acute onset or you think they may be struggling with Pans or Pandas, it's a great place to look and you can get a lot more information. But that's what we're talking about when I mention Pandas and Pans.
Okay. This person's asking about addressing pandas and pans. Is it strictly a nutritional intervention, or is this a
Oh, no.
combined approach?
Absolutely a combined approach. The consensus paper that was just written about it most recently talks about the fact that we need a three-pronged approach. And it is basically immune modulation, which means because we've got this immune response, the body is now attacking itself, essentially its own brain. We need to reduce the inflammatory response. We also need to do something antimicrobial, something to kill the germs that are causing this response. And then we also need psychiatric support. So it's all of those things. And many people, if they're seeing a physician, they may use antibiotics to address it. I use, because I'm not a doctor, I'm a dietitian, I use herbs, antimicrobial herbs to try to address it. And I also use herbs to reduce the inflammation. But there are people who, they generally often start with an antibiotic protocol, but there are, for kids who are severe or not responding, even things like IVIG, which is, immunoglobulin therapy, may be used. That's obviously something that I don't have any involvement with. That's a procedure, but it does require, treating Pans and Pandas really requires that three-pronged approach. You've got inflammation, you've got to address the germs, and you've got to provide the appropriate psychosocial support that the child needs.
All right, this person's saying, my doctor says there's nothing to the diet and my child doesn't have diarrhea or constipation. So I'm assuming that that means it wouldn't be effective for my child.
100% no. I've seen plenty of kids in my time, and my colleagues as well, who had kids who had perfectly normal bowels and responded beautifully to this diet, to gluten and casein free, as well as others. I know physicians continue to say that there's no reason for it. I think they're doing a disservice to their patients, because there is clinical evidence now where, again, we wish there was more evidence, we wish there were more studies of it, but there are studies that show both parent report as well as assessments of behavior in kids who do this diet that shows it improves their function. I think it's unfair to parents for a doctor to tell you it won't work, because we have all said we don't know which kid is going to be the kid who responds to it. It is trial and error. As I said at the beginning of this conversation, I would hate to be a parent who didn't do it and 5 years down the road wish I had. It's easier to do it and rule it out than not do it and wish you had. And I think it is a disservice to every parent with a child on the spectrum to tell them this diet doesn't work. And obviously I feel very, very strongly about that.
Well, okay. And as far as starting the diet, then if a parent's going to do that, are there particular supplements that are fairly safe for a parent to start with, like a multivitamin or supplementing with fish oil, things that they can do at home?
Sure. And again, we can't say this is individualized medical advice. This is a general conversation. But I think for most kids on the spectrum, the things that we see that they react well to are things like fish oil, a good hypoallergenic multivitamin, probiotics, digestive enzymes, things like that are really terrific. The right form of folate, which is a whole nother story for another day. But all of those things can be really helpful. And Jim Adams, if you Google Jim Adams, he does some wonderful studies. He's published a few. He's got another one coming out that looks at, and the Autism Research Institute website has parent ratings, and they talk about what were the things they found helped their children most. And that actually goes back to the question about the gluten and dairy-free diet. If you look at parent ratings, that's one of the things that is considered by parents to be one of the most effective interventions that they've done. But some of the baseline supplements, like I said, fish oil, digestive enzyme, probiotic, multivitamin, can really be helpful. And again, you've got to make sure you've got the right quality. You've got to make sure you've got the right type of product. And if you do that, you can certainly hopefully see benefits.
Okay, great. All right, another question. I know we typically get this one, so I appreciate you answering it again, but it's about sleep. So they're asking about, is there a connection between diet and sleep? Should I be thinking about issues with food when I see sleep disruption?
Some foods can disrupt sleep. Again, I see that often with either phenolic foods, which are unfortunately, again, some very healthy, brightly colored fruits and vegetables, but can have something called a phenolic effect or high salicylate foods, which can cause a bit of hyperactivity. But sometimes sleep disruption comes from supplementing with B vitamins too close to bedtime because B vitamins can be activating. The other thing I'd be really careful with before we accuse food is sleep hygiene. Our kids looking at screens before bed because we know that those are really activating and profoundly influence good sleep hygiene. So getting rid of those screens an hour or two before bedtime is really important for getting a child to settle. Um, I also think for some kids, something like melatonin can be helpful or other sleep aids, calming sleep aids that are nutritional in nature. I tend to not look at food as the culprit immediately. I will look at other things first. But yes, there are some foods that can be problematic. And for those, I generally look first at phenols.
Okay. And ideally, how long before bedtime would you want a person to eat? So what should that interval be?
Oh, about 2 hours.
Okay. So 2 hours is
Yep.
acceptable. Okay,
Thank
one
you.
last thing. I know we're on our way out. We need to finish up,
Yep.
but this question is about a great book. So if you had to pick one diet book that you would give to somebody when they were just trying to learn about diets and get started, um, you can
Well,
name more
if
than
it's
one.
if it's a gluten, if you're talking about like a therapeutic diet, I think Pam Compart and Dana Lake's books are amazing. They're excellent. I would highly recommend them. If you want a general book about healthy eating, I think Mark Hyman's new book, Food, is phenomenal.
Okay, great.
So those
Well,
are two that
Vicki,
I would strongly recommend.